Hi, everyone. My name is Brenda Linares, and I'm really glad to be here with you sharing about the project that I have been involved in Kansas. So if you're here to see the presentation, Juntos, Center for Advancing Latino Health and Librarians partner to provide credible health information in Spanish via podcasts. I am currently the School of Nursing librarian at the University of Kansas Medical Center, and this project wouldn't be possible without the collaboration and working together with Mariana Ramirez, who is the director of Juntos Center for Advancing Latino Health. Okay, just want to make sure, then I'll continue. So this is my presentation. So what am I going to be talking about today? First of all, I definitely want to acknowledge the National Library of Medicine and the All of Us program for funding our project. We're very grateful that we were able to work with them, and they funded and they liked the idea of this project and funded the project for the last 2 years. So a little bit of an outline for you to see what I will be talking with you today. I'll give you a bit of a background about the project, talk a bit about, of course, the importance of health literacy in the Latinx community, and then how our project came about when it came to development Juntos Radio as a health video podcast, thinking about finding the platform that will best for us. How do we thought about the topics to cover, the platform we use, how do we develop the brand for the podcast and the recordings, tell you a bit about how the production went with the Juntos Radio episodes, the things that we had to purchase to get this going, some of the topics that we included in the different podcasts and the episodes, and how we definitely want to go out there and promote this recording. So now that we had it, promoting it through social media, printed media, and doing more community outreach to make sure that the people know about this podcasts and are able to hear them and the information that we're sharing with them. And of course, ending with lessons learned and hopefully some of the future next steps that we're going to have for this project, and talking to you about the National Library of Medicine and the funding available. If you're thinking about projects that you want funding for, definitely that's a good resource to look into for these types of projects. So again, health literacy, information literacy in the Latinx population, as you've known and through this conference and the research that many of you do, the Spanish-speaking immigrants are particularly affected by the negative health outcomes, and this is a lot of the times impacted by the low health literacy that many of them have. And health literacy, of course, is a social determinant of health. And so what does that, in that entails is that because of that low health literacy and accessibility to information, there's a lot of issues that affect them when it comes to making decisions about their health and all of that. And therefore, they have low, not as much access to primary care and healthcare, and therefore all of that health literacy and all those three components affect the decisions they make about their health and how they're affected by that. So there's a lot of misinformation and mistrust in the Latinx community. One of those things has to do with the language barriers. A lot of the times they don't know what is being said. And so because you don't understand the language, there's a mistrust about what is being said to you or what's out there with that type of information. And of course, as we all know, there's a shortage of Spanish-speaking healthcare workers. And therefore, a lot of the times people tend to be reluctant to go to the doctor because they know that they feel like there's not going to be anyone out there that's going to be able to talk to them about their health issues, and are not going to be able to have a conversation where they can talk and ask questions. And so they're reluctant to go out there and have that. And again, there's less access to medical care. And a lot of the times the resources out there are not in Spanish, and they don't have that much access to it. And so that information doesn't get spread out to those communities. And when they do go to the doctor, they end up having lower quality of care than other populations. And because of that, not feeling comfortable going to the doctor and feeling that nobody out there understands them and they can explain things to them, a lot of the people in this population tend to rely on family and friends for information. I'll ask my abuela, I ask my aunts and uncles, or my cousins if there's a health issue that I'm dealing with. I know that they were probably going to tell me and help me do something so that I can get better. And so because of all of that mistrust and reaching out to people that probably don't have the correct information, they tend to get the wrong information about how to treat themselves, and therefore those health issues can get worse. This is an example that I actually saw online when I was doing research for the presentation, that again, looking at this one, when I said about relying on family and friends, somebody actually posted that and said, for example, her parents suggested that she wouldn't have to get to quarantine if she drank a homemade tea of lemon, honey, and ginger. And this daughter had to tell them, no, that's not true. In order to stop spreading, you have to stay at home. Because somehow they had seen this or heard this from somebody else, and they basically told people about this misinformation, and therefore they were spreading all of this that was not right. So how do we come about with, when it comes to technology and the project? With a lot of us, when we were trying to find information out there, we know that one of the tools that a lot of Latinos use is smartphones. We use that to communicate with each other. We have information in there, and as you can see, 92% of Latinos 18 years or older own a smartphone, and they carry their phones everywhere, and that's how they access information. That's how they access the internet, because in many instances they might not have internet at home, so the way that they access the internet or those resources is via their phone that they take with them everywhere. And this is a way to connect the community with new things around them. And I see here's the other chart too about how they rely heavily when it comes to smartphones and those devices for health information, but educational content, and even job seeking. So we knew that they have a smartphone, this tool that they can use, and they take it everywhere. Therefore, you can reach out to them via that tool. So knowing this is when we started having those ideas of what can we do to reach out this community. So because of that, I work at the Dykes Library, and Mariana is the director of Juntos. As you can see, Juntos, it's part of the University of Kansas Medical Center, and it's a program that's part of the university. And they want to do is basically they want to go out there and eliminate health disparities in underreserved Latino communities in Kansas. So they already are doing a lot of outreach, trying to recruit people for clinical trials and educating them about health information and health resources and programs available for them with the university, but also in the community as a whole. So we knew that they had all this outreach experience and these resources, and in the library having my experience as involved in outreach programs, health literacy, consumer health training and education for my previous jobs at the University of Miami and also at UNC Chapel Hill, and working with diverse communities. I had met Mariana in some meetings on campus, and as we started talking about one of the things that they wanted to do and my experience, we wanted to say, I think there's something we can do together so that we can go out there and do more training and reach out to the community when it comes to health information. And so we had those conversations and brainstorming ideas, and I had told her that I knew about the network of the National Library of Medicine and how they fund different projects when it comes to doing outreach and consumer health and training, and we could together see what type of funding was there that they could fund a project for Juntos and doing outreach in the community itself. So because of that, in those conversations, we had a couple of informal conversations and brainstorming ideas of projects that they potentially wanted to do, and my experience with resources and as a librarian and building relationships with the community, we started brainstorming ideas. And so one of the things that came to mind was like, well, they have mobile devices that people carry with them. What about podcasts? That's the big thing that's going on right now. People listen to different types of podcasts, any type of out there. And so I'm just, because of that, and because I have you and all of you probably have some podcasts out there that you listen to, if anybody wants to post in the chat some of those podcasts that you listen to that have to do with health or of outreach, I definitely would love to see some of that in the chat. So I'll give you maybe a couple of 30 seconds or so if you have any that you would recommend to put it in the chat so others can hear about them as I talk to you about this particular podcast project that we worked on. So I'm going to look in the chat and see if anybody posts some ideas or some of the podcasts that you listen to. that other people might want to know about. And I'll definitely continue with the presentation, but if any of those topics or podcasts that you want us to know about come up, please feel free to put them in the chat. I know that a lot of people attending will be able to take advantage of those to listen to, and I hope you definitely follow the ones that I'm going to talk to you about. So what was it that we wanted to do? As I mentioned earlier, we knew that a lot of people in the community have their mobile devices that they take everywhere. And so what do we wanted to do? We wanted to increase access to evidence-based health information among Spanish-speaking Latinos through a podcast and social media video content, because we knew that there's a lot of podcasts out there in English, but we had not seen as many in Spanish that we could basically think, okay, this is more potentially targeted to the Latino community, depending on the health literacy levels. Is there something that they can understand and relate to? And so this is when we said, you know what, this could be something. I think there's something that we can do about this type of project that we can create. And so we went and reached out to the Network of National Librarian Medicine and all of us funding, and said, hey, we want to do this project. This is the idea, and we want to incorporate some of the health information resources in Spanish that the National Library of Medicine already has, and other ones out there that we can incorporate as supplementing the topics that I want to cover in this podcast. So we wanted to then create a Juntos Radio where people could listen to topics, specific health topics, and then have a supplement of health information resources in their language. So we wanted to do this. We wanted to do this type of radio. We did several reviews and try to figure out, okay, what's the best way to reach out to this community? And so we looked at some reviews on interventions, different platforms, and definitely wanted to see, okay, it looks like smartphones is the way to go. What type of apps can we use to be able to reach out and have these recordings? And we also said, you know what, we want to do a podcast, but maybe we can also do videos that we can post on Facebook and YouTube, for people can be able to see this when they're anywhere walking around. And so we realized, okay, this is what we're going to do. We're going to record these videos and we're going to put them in the different platforms for people to listen to in their own language, created by Spanish-speaking guest speakers, so that it's not being translated. They're listening to someone that's speaking their language. So how does this came about? So now that we knew we wanted to do a podcast, we knew that we wanted to put it in social medias, and we wanted to do different recordings of it, and we had the funding, we definitely said, okay, this is some of the things that we need to do if we wanted to start production of these recordings. We needed time for recording and editing those videos, because we knew that we didn't have experts in our department and in our school. So we wanted to see, okay, we can use some of this money to buy software to do some of these recordings and do some of the editings. We can have our own space in the Juntos offices, so we can invite the speakers come and be able to do the recordings, and therefore we can buy equipment. And so we bought microphones, we bought video cameras, editing software. We hired somebody that had experience with editing, and special headphones and mics that we could be able to record those episodes. And then we knew that as part of that, we also wanted to have Spanish captioning of the recordings. And that was the plan, because this was back in 2019 when we started working on this idea, and applied for the funding in towards the middle of 2019. And so this was going to be, again, it was going to be in person. We were going to have the space. We got the mics, we got the video cameras, we had all that software that we were going to use to do that. And then we basically had that funding that end of the year. And so we started with working on the recordings and the episodes late 2019, early 2020. And then what happened? We had the pandemic hit. And so then you saw that we bought all these tools and technologies to get this going. And then we said, okay, well, we can't be in person because but we still want to make sure we move on with the project itself. We then had to move and do Zoom recordings. We figured out that that was an easier software to work with. You can just have the link. Everybody could be anywhere, change their background, pick a space in their house so we can be able to record and be quiet. And it would be a bit easier to do some of the editing of those videos. And then the thing was that we had bought all this great equipment that we wanted to use in our Juntos office spaces. Well, now we had to just see what everybody had in their own spaces with their own equipment. And luckily, if you had your laptop, good headphones, good mic, we worked with that. And that's how we then ended up moving forward with the recordings. We had 1 or 2 episodes that we were able to do in person because it was right before the pandemic hit. But for the most part, it ended up all of those videos that we have been recording have been via Zoom and virtual, because everybody has to be in their own place and we can't meet in the same place. So because that's a little bit of a background how we recorded it, so we said, okay, we need to do now the recordings, and just give you an idea about how the brainstorming happened. Again, we wanted to make sure that this was a Spanish language podcast where the people coming and guest speakers spoke specifically, it was in Spanish, so that we didn't have to do any translating. They were there talking to the community, and therefore many of those people that we invited were healthcare providers and experts that are part of the Latinx community, and therefore it would feel more like, okay, somebody from my own community is telling me about these topics, I'm listening to them. I don't have to have any translations of what they're saying. I'm hearing them directly. And so we created a bit of an avatar and try to think about, okay, how can we reach out to the community where they're going to have something credible? And so we kind of thought about having this be a female, married with children, Spanish speaking. And so that way it would be more of like a welcoming, someone that looks like me type of participant. And then we basically, the department, they're called Juntos, so we just added, why don't we just call it Juntos Radio, Salud Sin Filtros, or basically health without filters, because that way you can talk about different topics that are important to the community and be able to link those recordings to our website and to other social media. And then we just said, you know what, how are we going to do those episodes? Well, we want to do it in a way that people can listen to it and relate. So why don't we do it in a way that it's interviewing different healthcare professionals, and they're giving us updates on the research that they're doing or a topic that is relevant and current during the time, and do it in plain language so that people can listen and be able to understand what they're talking about, and also create some type of narrative, and even have people from the community ask questions and have it be that way, a bit of an interactive where, you know, maybe there's some myths about some specific health topic and they can submit those questions and those myths, and we can cover those and provide additional information. So by having those episodes have that length, you have the content. And then my role as a librarian was to, well, you know, if we have all these topics, we want to provide a supplement of resources where people can go and link to find out more information in their language on this topic. So we were able to provide supplement information so they could listen to the episode, and then at the end look at some of the links that were added to that episode when it came to some of the health topics. And I'll show you as we go to the other slides. And for the most part, we did a bit of a pilot testing in person before COVID happened, and we had a great feedback, and it was great to hear what people wanted to hear, the topics and the format that they liked. So when it came to the health topics, we wanted to make sure that we were covering topics that were of interest and was affecting the community. And so we went out there and looked at the CDC and the research and say, okay, which topics are people are looking for, or where do they go for that information? And then what are those key health topics that we need to educate our Latinx community with? And so before COVID-19 happened, we had a list of different topics that we were going to be covering and including in those recordings with the supplement health information material. And so I mentioned some of that right now because, like I said, we had the recordings, and then we would add supplementary consumer health resources that we use. Many of them were by the National Library of Medicine, but we definitely incorporated resources from other organizations that we knew they were credible, authoritative, and had information in Spanish in a level that the community could be able to understand. So I'm going to give it, maybe if there's someone there, is there anyone that has some of the resources that they use on the chat? Please share some of that, and I'll share some of the list of the resources that we use for that. So here are some of the resources we use for the podcast to supplement the topics that are being covered. Of course, we use Medline Plus, some of the CDC information, kidshealth.org, healthykids.org, some from the NIH, the National Institute on Aging, and the Mayo Clinic. So we definitely, depending on what the topic was, we incorporated some of that information into it and linked it to the recordings. Because we knew that depending on some of that information, it could come up from foundations or other nonprofit organizations. And so my role was there as the librarian to make sure that the resources that we were using to supplement and add to this was credible and authoritative, like I mentioned earlier. So what did those recordings look like? So here's something to keep in mind. Like I mentioned, we got the grant in 2019 and starting the process of creating the videos and the ideas in the fall of 2019, and started the recordings in March of 2020. So from March of 2020 till now, there has been 32 recordings of those episodes. We tend to post them bi-weekly. And what we've done is we basically have been able to, from the beginning, get people that work at the University of Kansas Medical Center who are from the community, have been involved in research, and come and talk about their own research or specific expertise and the topics, and have that be more of a way to have an interactive conversation with them and tell us about what the type of research that they do. And there's been, again, different health topics. And as you can see on the right side, we started with potentially general topic about COVID-19, but then we put stuff about, child obesity, Alzheimer's, hypertension, physical activities, and all those topics that we definitely felt that it was important for the community to know about. I even did one on health literacy myself, because I speak Spanish and was able to talk more about the resources and how important that is when it comes to making information about your own health. And so we basically started with knowing and using the people that we had on campus or locally in Kansas, but as we've gone to promote the recordings to other groups, we've actually gotten people coming up from other organizations that want to do an episode and recording it to the for us, and that we can basically have that and promote more knowledge about the topics. So this was some of them. Like I said, there's 32 recordings, and we have had different recordings on different topics. But then when COVID-19 happened, we, for the most part, put some of those general topics on hold and decided to focus a lot on getting the word out there when it came to COVID-19 and relevant topics that we needed to put out there for the community to know about. And so this is some of the episodes that we specifically focused on COVID-19, so that way people knew more about it, especially talking about previously, like I mentioned earlier in my presentation, that we were knowing how there's some misinformation in the community about different topics, specifically about COVID-19. And so we did these recordings about social distancing during the holidays. I know that we love to host, parties and get together with the family, but the importance of not doing that last year, and the physical activities during lockdown. So we had those topics being covered, and because we had people on campus that were leading clinical trials, we got them to come and talk about how a clinical trial works, some of the clinical trials that they were involved in, and why it was important for us to recruit more people from the Latinx community to participate in those clinical trials, to have more participants and more information on that, and how vaccines, especially when there's some misinformation about what vaccines do, making sure we had those episodes. And we basically, once we knew COVID-19 was happening, we went out there and started covering those topics, getting guest speakers to do that. As you can see that we kind of a recording on myths about the vaccine, because we knew that people out there were reluctant to get vaccinated once that happened. And so we wanted to get that word out there. And so we included the different researchers to do the recording on those topics, and then again added supplement and Spanish information for that topic itself. And what did that look like based on those topics? So as you can see, here's a sample of how it would look like. On my left side, you see that this is what it would look like if you go to the YouTube video and see a recording of that. This is one of the first episodes that was done in person, because COVID-19 hadn't happened and we didn't have to go and work remotely. But you can see is here's a recording. Here's when we actually were able to use some of the equipment and tools we used. And then we had people asking questions about the topic. And then at the bottom of the YouTube channel in that specific episode, we had a bit of the information of who is the one in the episode, and then resources and websites where they can find relevant information to that topic, so they could click and go to it and find additional information, and telling you specifically also about the background of that healthcare specialist, because that way you knew that he was part of the community. So that's how it looks on the YouTube video. And then on the right side, we had been able to put it in Podbean. And so as you can see, that's what it says, we've had the 32 episodes, and total of those 32 episodes, we had more than 1,000 downloads, which is great because I know we reach into the community. And again, you see that you can listen to it, you can put play, and because again, people go in their mobile devices, they can download Podbean, go to the Juntos Radio, listen to that episode, and within the app itself and the episode, again, you can link and see the resources for that are relevant to that topic itself. And so this is a bit of seeing you how the visual looks like for people, in one case, wanting to see the video and seeing the people talking and doing the recording. And in the other one, having that Podbean app in their phones and being able to just go ahead and listen to it wherever they are on those health topics. So that's how it looks like. And so just to give you a bit of a sample, here's a sample of the YouTube video for you to listen to it and see how it plays. And so I should have sound, so I'm gonna just put play for you to see a brief content of one of them. And this is about the vaccine. So I'm gonna put play, and if you can let me chat if you're able to hear it, please.
Bienvenidos a Juntos Radio,
el programa de salud sin filtros. Yo soy Laura, médico pasante de Servicio Social de la Universidad Autónoma del Estado de Hidalgo en México, haciendo mi servicio social en Juntos.
Y yo soy Mariana, directora del Centro Juntos para mejorar la salud latina en el Centro Médico de la Universidad de Kansas,
trayéndoles información de salud confiable en colaboración con la Red Nacional de Bibliotecas de Medicina, y todos los derechos están reservados.
Y hoy vamos a hablar de un tema del que todos queremos escuchar buenas noticias: la vacuna del COVID.
Y además, este estudio está liderado por 2 investigadores latinos. Tenemos con nosotros al doctor Mario Castro, neumólogo, jefe de la División de Neumología, Cuidado Crítico y Medicina del Sueño en el Centro Médico de la Universidad de Kansas y vicedirector de Investigación Clínica y Translacional.
Y también tenemos a la doctora Bárbara Pajut. Ella es directora de investigación en la División de Enfermedades Pediátricas Infecciosas y profesora asociada de pediatría en la Escuela de Medicina de la Universidad de Missouri en Kansas City.
Bienvenidos, doctores Bárbara y Mario.
Hola. Hola, ¿cómo estás?
Bueno, y doctor Mario, ¿qué labor tan importante ahorita, ¿no? El encontrar una vacuna para el COVID-19. ¿Nos quiere platicar sobre el estudio que están liderando usted y la doctora Pajut y sobre su rol en él?
Sí, cómo no. Gracias, Mariana. Y estamos muy excitados porque hoy día vamos a empezar 3 investigaciones aquí en los Estados Unidos sobre la vacuna.
Just wanted to give you a brief intro, and you can definitely go ahead and go to our channels. I'm going to put that at the end of the slides. And I see that there's some questions, so I'll definitely make sure I'm going to answer those questions as I go through the presentation. So as you can see, this is an episode in Spanish, and we had those same episodes put in the YouTube channel. So here we go. Somebody was asking, what did we do? So basically what we did was we had a YouTube channel and then a Podbean account. And so what we've done is we uploaded those recordings into those social media platforms. They are definitely not on Zoom. They were recorded with Zoom, but those recordings then were worked in so that we can put it in these different platforms. So at the end of the slides, I have a link to the Podbean channel that we have, Spotify, Facebook, and YouTube. As you saw that channel, we also put some of those videos in Instagram to see if people get to them that way, and also in Apple Podcasts. So we're trying to put them and let them out in those different social media platforms, depending on what people are more comfortable using with. And so we have our own Podbean, Radio Juntos, and then also the YouTube channel and Facebook. So I'll definitely, this is basically one of the ways that we promoted them in those platforms. And then we've linked to them in our Juntos website so people can be able to see them and listen to them that way. And just to give you an idea, you know, this is, I know we put them in the different platforms, but then here's just to have an idea of the different views that we've had. This is just all the topics when it came to COVID-19. And as you can see, this is some of the views that we've had for those topics. Especially as you can see, the one for the vaccine development had 239 views. And again, this is, I meant to update the views, but there's definitely more, there's more views that have happened within the last month or 2 months for sure. So this is something that that to keep in mind, how much it has been for those topics themselves in YouTube. Then we mentioned that it's also in Podbean. So as you can see the different downloads for the different topics themselves. Again, when I took this, when I looked at the numbers of downloads, and I think I looked at this maybe a while back, the physical activity during lockdown was the one that had the downloads. But I do, as you saw the statistics earlier when I said for the Podbean, if I was talking about it here, for the 32 episodes, there's been 1,056 downloads overall. And this was, I think that screenshot was for, I believe, a week ago. So as you can see, this here is definitely smaller because this statistics were taken a while back. So that's more of an updated data. And then, so that's some of that, how that has happened. So here's some of we basically, like I said, we did a bit of a pilot testing at the beginning before COVID. And then now we've done a couple of focus group virtually or over the phone and asked for their feedback for people that have seen the video. And as you can see, 84% of the people that we asked about this podcast, they said they liked it a lot. More than 85 said it helped them, and they said that it was reliable. And now, because of this podcast, 76% said that they know more about health topics, and they were definitely interested based on the links we added for those NLM resources at the end of the episodes. They wanted to go and look at information in those specific resources. So this is more like preliminary data and trying to get more feedback on the videos and the recordings to make sure that we're getting to the community. And how do we disseminate it? Somebody was asking. Well, as you can see, we posted them in those social media platforms, but we also done more of a community outreach. I have, for example, a screenshot there of one of our local newspapers, Dos Más Dos. It's a bilingual local newspaper, and it just happened to be one of those days I was just happened to go to the grocery store and I saw this, and this was basically at the front of the page. So I was really excited that, again, we were promoting this project in a printed newspaper so people knew about it and they would get access to and know more about Juntos and what they do, but also know about the podcast that we're recording And I believe also that Mariana mentioned that they have been, they had a brief mentioning about it in Telemundo, which is a Spanish speaking channel, to again promote that locally here in the state of Kansas and be able to learn about this podcast and these videos that are being created by Juntos in collaboration with other healthcare providers from our community, and also because of our different networks. For me as a medical librarian, promoting the recordings, I've been able to reach out with some of my medical librarian colleagues in North Carolina, in Pennsylvania, even in California, to tell them as they do outreach and work with the Latinx communities out there, to tell them about this recording, because I know that this was starting as a thing for the community here in Kansas, but a lot of this is relevant to all the Spanish-speaking populations. And so we've been able to promote this by word of mouth to those particular states. And we're hoping that as we do and share this project, all of you learn about them and be able to use them and promote them and link them to some of the resources you would potentially have available. But this is, again, the way that we've been able to promote it and disseminate it, not just online, but also through printed media, to doing community outreach, and even the TV, and doing that type of advertisement and marketing of it, to make sure that people are aware of that's available for them to download into your phones. Lessons learned. I know there's a lot of things that we can talk about it, but some of the things that we learned, and I know that you probably would be interested in, is, again, we noticed that when we started, we had not considered the pandemic. And so you saw that we purchased some of that equipment, and then we had to go back and do all of this remotely from our homes. And we were glad that we were able to use the technology that people have at homes, such as their computer, good internet access, basic headphones to hear the recordings and be able to do that. But something was to think in mind is a lot of those recordings take space. So keeping, buying more external drives to be able to save that as we have that raw recordings to then make it edited to fit the different platforms. And at the beginning, we were able to do a couple of focus groups as we were brainstorming the idea, and maybe one or two of those topics that we recorded in person. But then because of what happened, we had to go and conduct some of those focus groups virtually, which has been a bit of a challenge to recruit people to provide feedback. And so getting that and getting those people to get their feedback has been a bit of a challenge, instead of being able to have a place that we can go to, a community event or anything like that, so we can promote that. So that's something that to keep in mind. And then we learned definitely early on that people wanted shorter episodes. We thought that we wanted to do 30 minutes. And then as you see and get a chance to see the videos, we, depending on the topic, they tend to be 8 minutes, 10 minutes, or 12 minutes, because people want something that's short and quick to listen to on the drive somewhere or a run. So definitely something to keep in mind. And then thinking about it when it comes to transcribing the episodes in Spanish, that took a little bit more time than we thought it was going to, for some of those videos, to make sure that the captioning is in Spanish. And things to keep in mind, as people wanted to do something like this, putting the videos on YouTube and Facebook, they're free platforms, so we didn't have to spend any money on that. I know that Podbean you can do it, you join free or have a monthly fee, depending on the type of storage you want to use and the type of recordings you're putting in there. Again, as you can see, one of the monthly packages is $9, but I think, things depending on how much you want to use it or how much you want to put in there, it could be longer than, it could be more expensive than that. Editing software, at first we thought we were going to have someone hired, and we had that, but then as we got, less funding and thinking about that continuity, we might have to learn more about how to edit those videos, because we want to continue doing this. And if the funding runs out, potentially apply for other grants, but definitely having that within in-house. And as you saw with some of the images and slides, wanting to make sure we found public domain images. And definitely, hopefully, as we do this in person, having those access to those mics and headphones. And then what are the next steps? We want to continue doing the recording, and keeping in mind that we want to make sure it's more culturally and linguistically tailored to the population itself, and disseminating that information with evidence-based information. We want to make sure we increase the local and national partnerships with the community-based organizations to expand our reach, but also letting them know about this recording so they can use for their populations in the communities. And we're hoping that the funding, which the funding ended, we had a 2-year funding for the project. It ended at the end of April. So now we're trying to see how we can potentially find additional funding and finding ways to be able to maintain this and keep going with the recordings. And we've been doing that. And so seeing how can we maintain this and be able to do recordings of other topics, and want to make sure we keep on getting more feedback from groups in ways that we can improve the recordings, the topics, the way we're doing this. So here's some of the links for the social media. So if you look for us on Facebook, the YouTube channel, Instagram, we'll put some information on Twitter. If you go to the webpage, the juntosks.org, you'll see the links to the different platforms where we're putting the recordings of the videos. And there's the link to the Juntos radio in Podbean. And definitely keeping in mind, we got funding for the National Library of Medicine for the last, the last 2 years to be able to fund this project. If any of you are interested in any other types of projects that could be similar to this, or ideas that you want to do when it comes to outreach and health literacy, definitely recommend looking into the network of the National Library of Medicine for funding. I listed the regions there. I don't have the map because they're new regions now, and so we want to make sure that they hopefully, as there was a new reorganization of the different regions, you can see which region works with your state, and I definitely recommend reaching out to them because there could be some funding available for any projects you're interested in. Let's see, and here's a quick 30-second, I think it was there, and I don't think I have a link here, but we work on a bit of a 30-second advertising video that we wanted to do for the radio itself, and be able to, people can use that to learn more about Juntos quickly. So that's the presentation itself. I'm going to go back and leave it in the links for the social media. And I know that there were a couple of questions, so let me see if I can answer them. I know that I have like 12 minutes to do so, but that's my presentation. I hope you enjoyed it, and please reach out to me if you have any questions. And I'm going to see some of the questions and see if I can answer some of them. And someone says, how do we appropriate share these programs with English speakers with our Spanish speaking clients? That's a good question. And I think one of the reasons we wanted to have people in the recordings and the people that we invited to do the programming and answering the questions, we wanted it to be healthcare providers that were part of the community to build that type of trust. And I know that sometimes we don't have that many of them. So we have been fortunate that in all the different videos that we recorded on the topics, we've had someone that speaks Spanish talk directly to the people that are interviewing them to do that. So I think in this case, one of the things is, you have those resources and you want to reach out to the community, promote it in a way that says, this is something credible. It's someone that it's talking to you from the community itself. They're the ones that are leading the research. Like in this case that we had, one of our doctors was the lead in the clinical trial for one of the vaccines that we were doing there. So kind of showing them that these are people from their community, and hopefully that would get more credibility. Let's see what else I'm saying. And I think I said something about the promotion. As you can see, we post them on the YouTube videos, and you can see the link there. You can go to the Juntos YouTube channel and see the listings of the different videos that we recorded. And all of this, because it's funded by the National Library of Medicine, all of you, everybody has access to it, can put it and link it to the resources for people to use. And that's what we said. Even when it came to the photographs we used, we wanted to make sure that everything was open access, and being able to use by anyone, that you don't have to pay anything to have access to it and share with any populations. Somebody was saying about, were you satisfied with the number of listeners? I think we definitely want more people listening to them, but I think at least we know that there's people out there listening to it. And I think for us, it's like if we can make a difference in at least a couple of people's lives, and they're paying attention and they're going out there and getting the vaccine and potentially participating in clinical trials, we feel that we are successful in that way. And I think one of the reasons too we're promoting this across the country is that we're hoping that would get more views and more traffic to the videos themselves. And somebody said, what's the name of the podcast? That's hopefully by having that in the link here in that page, you can see that if you look for the Juntos Radio as part of the Podbean, you can find it there. It should be you should be able to find it, and I have the website there for you too. And then, that's a good question. They incorporate some sort of satisfaction rating option to gain feedback from the viewers on your platform of video. That's a good question. I wonder, I think we haven't done that specifically as people finish watching the video. That's something I'm definitely going to bring back and share with Mariana in Juntos, that maybe we can do something to the future videos that we want to record, so we can have that immediate feedback after people watch the video, because some of the feedback we've had is either people commenting it at the end of the video in the YouTube comments or Facebook comments, but we haven't had something more formal to keep track of, because one of the things we see is, well, people saw it, how many views, how many people download it, and if they put likes or not likes through the social media platforms. But that's a good thing to definitely pursue and see if there's something we can add to that quickly, so we can have that quick feedback. Yes, you mentioned I didn't listed all the topics we cover, but we definitely went to some of the. Mariana has a lot of relationships and partnerships with different community organizations here in the Kansas City area. So she definitely worked with some of the other topics that we covered based on what were the needs that they wanted to hear, and so it was more like, when COVID hit, we definitely wanted to cover those topics because we thought it was important to cover those topics. Then we looked at those top health issues that are affecting the Latino population, so we wanted to make sure we included those, and then definitely having those conversations and saying, are there any other topics that we want to cover? And so we've done some of that too. And then people that have heard about the topics that we cover or the radio, they reach out to us and say, we know that there's a need for the people to know more about Alzheimer's or things like that. Can we do a recording? And so we've done that too. So there's been a variety of ways of how we've incorporated some of the topics that we cover. And yeah, so in addition to that, as you can see, we had all these different topics that we were going to cover. The health literacy one, we eventually posted that, but before COVID-19 happened, we had a listing of general topics that we were going to be covering. But then when COVID-19 hit, we basically put the other topics on hold. And a lot of the ones that I mentioned in the slides where it was all COVID related, those were the ones that we basically kept putting them like in March, in April, in May, during the summer when they were doing research on the vaccines, and then in the holidays, because we knew that those were important to have out there for people to listen to, because they were relevant to what was going on in the country. So that's why we then put a priority on those topics before the other ones that we had thought about recording. But we did try to balance it out. And so once in a while, for example, when we did the ones about social distancing or the ones about exercising while at home, we did put some of them maybe about diabetes in between some of those, so that we could have a balance of not just covering about COVID-19, but something that could be relevant to that during that time. Yeah, any other questions? That's a good comment, and I think for the most part we focus on the more because we were focusing, for example, it started with the Kansas City area. We know there's a lot of immigrants from Mexico, and I know from Central America, and so you're right. There's a lot of that we tend to think about when it comes to the accents and the dialects that we speak. I think one of the things that we haven't even thought about is, and I think that's a challenge, is we also have a lot of immigrants that Spanish is their second language, because they have their own dialects, like, from the Mayan communities in Central America, where my family is from. I know there's a lot of them, or even from Mexico. So that's a good question that we definitely need to look more into it and be more inclusive when it comes to those different dialects, because we try to, as you can see, the people that were doing the interviewing, I believe both of them are Mexican American, so they have that type of Mexican American accent when they speak. I know that one of the researchers that we had several of them, depending on the topic. Some of them are, Puerto Rican, Dominican Republic, Mexican American, I think even Peruvians. So we definitely, it helped in a way to get some of the people that were invited as healthcare providers to do to be interviewed on the different topics. They came from different countries in Latin America, and so they had some of the different accents where they speak. But you're right in terms of the how there's different dialects and ways that they speak. For the most part, because a lot of us speak Spanish, we didn't use as much of the Google Translate for when we were doing the transcripts and asking the questions, because for many of us, Spanish was our primary language growing up, and then, in the United States, we were able to do some of the translating ourselves. But you're right, that also tends to be really important to keep in mind when it comes to the translating and looking for that information that it's easy to find. So does that answer your question? I hope so. I know there's a lot of, in this we just cover the Spanish speaking populations, but there's a lot of people within this community that would benefit if we were able to do some of this in their native dialects, for sure. Yeah. Any other questions? Please feel free to email me or contact me if you have any questions, or if you would love to, promote this in any of your website or resources you have, or even, like I said, we've had people reach out to us, and there's a particular research or topic that you want to make sure we could potentially cover. We would love to find more collaborators to work on this and keep this work going, to reach out to the communities. Let me see, I'm looking at another question. Yes, so that's another good question. So because right now like I said, some of the feedback when I said in some of the slides about, they said that they definitely like the recordings, they want to check out the NLM resources. Some of that was done via phone. We did some of those focus groups, a couple of, I think it was, let's see, right now we're in May, in March, in April, that we basically reach out and had some flyers out there in some community organizations and say, we want to get your feedback on this. Can you reach out to us and tell us what you think? So we did a bit of that outreach to get feedback from our local users that we had access to. We haven't done much of feedback from people outside of the Kansas area, and I think that's something good to pursue, to make sure we get that feedback, because, like, there's different people. We're so different in the Latino community that it would be interesting to see what perception we get from people like in California or North Carolina, where I know that I share some of the links to this recording. So I definitely want to make sure I keep that in mind and that feedback. So I'm definitely, if Scarlett, if you can share those questions with me, I definitely want to pursue more of that to make sure like I can go back and talk to Mariana about these ideas and these questions. I hope that that answers your question. I know I didn't really answer it, but I know that there's still more that we want to do when it comes to feedback. And right now, we're hoping that once we can go do things in person, we can go more into this community centers or community organizations that we have a relationship with, and be able to find out more, get more feedback from them. Because I think a lot of the times you don't get as much if you're virtually or on the phone with someone. You'll get more of that content and that feedback if you're in person with them in the same room. So we're hoping that you can get more of that and have more of a conversation. What are the topics that we can cover in addition to the ones we have already, but also getting feedback from people in other places in the country itself. Okay, and it looks like they can share my email, so definitely please reach out to me if you have any questions. Thank you so much.